Thank you all for joining us today. I'm Jen Harris of Montgomery County, and of course, we have Dr. Bissell here joining us. Following some comments from Dr. Bissell, she'll take any questions you may have. Again, please use for those of you who have been with us several times over the last several months, you know the drill. You can ask those questions using the chat or the Q&A, and we look forward to hearing what you have to ask today. Thanks so much. Thanks for being here, Dr. Bissell.
And thank you so much. Thank you everyone for joining us. Happy Monday. We do continue to see a drop in COVID cases across the region, as well as COVID hospitalizations. I know the new CDC guidance that was published a week or so ago still has us in the high range. That was actually recently updated on Thursday of last week and is only being updated every week. But on today's epi curves, we see for that the entire district is under 200 cases in the past week. Our hospitalizations are down into single digits pretty much across the area as well. So I do expect that we will at least be into the yellow, and possibly some of our localities will be in the green with this week's CDC transmission guidance update. And that fits what we're seeing across the state and across the country. We were a little bit later to peak, so we were a little bit later to kind of decline like this. But this is that transition to living with COVID, you know, the nice weather, springtime coming. I think we're in a good place right now. As we've talked about, we do expect that COVID is going to be more regional and seasonal. It's not going to go away. There will be other variants. We'll see what happens this summer in our neighbors to the south. And then we'll kind of expect, have a better idea of what to expect come fall if we're going to see something more. It's all about now that individual risk tolerance, individual risk assessments, family risk tolerance, family assessments. And then as far as the masking goes, really that personal protection, wearing the mask for that personal protection, and how that informs your behavior. So, we continue to test, although the demand for testing has gone down significantly. I think that's a combination of cases dropping down. People who are sick just are assuming they have it and not getting tested. People can get home tests. So I think that's a lot of things. And remember, we always said that we never fully documented the number of cases. They're probably 4 to 5 times the numbers that we've documented. So I think that's pretty much what I had. We continue to vaccinate as well. We're following the FDA if they make any changes or authorize any new vaccines, and we'll continue to offer them through the health department and kind of wrapping that in with all of our other health department services that we continue to practice, and we have catching up to do from the past 2 years. So I'll go ahead and take questions.
Okay, our first question is coming in from Jean. Some entertainment venues are still requiring proof of vaccination at the door, or a test if not vaccinated, a negative test if not vaccinated, while others are not, even if they still require masks. Do you see that going away anytime soon? Is there any scientific reason for these places to still require a test result before entry?
Individual organizations can do what they want to try and keep the community safe, especially if it's an indoor gathering of a large number of people. I do think as our case numbers continue to decline significantly, that there's probably not going to be a need for that. A negative test is not a guarantee that a person is negative. I think the root of it really is we need people to do the right thing, and that if they're sick, stay home. Unfortunately, that doesn't always happen. People paid for those concert tickets, or they paid for those tickets, and even if they're not feeling well, they're still bound and determined that they're going to go. And certainly with a highly transmissible respiratory virus like COVID, that's a recipe for spreading. I think individual venues, they've suffered a lot over the past couple of years, and they're just trying to do the best they can to get back to some semblance of normal and to regroup and recover. So I don't think we can fault them for doing that. I do think as case numbers go down, as weather continues to improve, and as COVID isn't quite as dominant on people's minds, that a lot of those things will go away. And we're seeing that. I believe New York is dropping a lot of those. You see overseas, a lot of countries are dropping the so-called vaccine passports and testing requirements as well. So I do think that's going to come too.
Okay, our next question is coming in from Daniel. The AP is reporting millions of doses have been disposed of nationwide because of expiration or refrigeration issues. Have we seen a lot of these disposals in our area, and what is BVH doing to save and administer these shots?
So we do not have refrigeration issues, and I can tell you that for all of my localities within VDH, that we all have ultra cold capability, and then the vaccines are good for 10 weeks in the refrigerator, the Pfizer, which is the ultra cold. As far as expiration, that can be an issue. We do our best to try and redistribute. But when the vaccine demand has gone down significantly, you can't always redistribute. And unfortunately, some of the vaccine will expire. We do our best to work with our community partners. We do our best to work with other health districts and really redistribute the vaccine to avoid, and minimize any expiration and the need to dispose of it. And I can tell you that we do not have we are not disposing of any vaccine because of refrigeration issues. We've got the capacity for that.
Okay. Duke was a little bit late in joining us, so he's hoping that you'll repeat when ideally we'll see the next update for COVID numbers. For the NRV, is the trend for COVID decreasing, and do you expect that to continue?
So our epi curves will be posted hopefully today or tomorrow on the NRV Road to Wellness website, and it clearly shows cases down in the curve that Omicron has shown pretty much everywhere else. As far as the CDC and the community transmission that they've switched to, they update that either Thursday evening or Friday morning, and they're only updating it weekly, which is a little bit frustrating because things are changing much quicker than weekly. So the last update was last March 3rd, 4th time frame. I expect the next one will be the 10th, 11th, this Thursday, Friday. And as I said, given what our epi curves, we do them by MMWR week. And so we do them each Monday morning because it runs through Sunday's numbers. We fully expect all of our localities to be out of the orange and into yellow, and some to be in the green.
Hey, Tom has a question. We are marking 2 years since the first case was diagnosed in Virginia. What do you expect the next 2 years to look like as we learn to live with COVID?
So, COVID's not going to go away, and there's a lot of reasons for that. It's so transmissible. The animal host. There's a lot of reasons that COVID's not going to go away. We do expect that we will have to learn to live with it. And there will be other variants. And remember, part of it too is a large percentage of the world is still not vaccinated yet. And, one of the biggest public health obstacles right now is dealing with that vaccine inequity. So we're trying to work on that as best we can as a country and the world. So we do expect there will be other variants. We do expect that they will be kind of like other respiratory illnesses, such as the flu and respiratory syncytial virus, that they will have that kind of regional and seasonal spread. Anything that drives people indoors. So our states to the south that get driven indoors because of the extreme heat in the summer may see something over the summer, just like they did last summer. We may see something in the fall. The biggest thing is how much of a disruption it causes to everyone's life. We have done a very good job vaccinating. In Virginia, well over 70% of the population is vaccinated. We have a decent booster rate, not quite as high as I think we would prefer to get. And then, of course, the immunity from prior infection. And so, obviously, the Omicron wave caused a significant number of infections. And so with those, we're hopeful that a new variant is not going to be nearly as disruptive, and we will learn to kind of live with those ebbs and flows like we do with the flu. Will we be getting annual boosters or other kinds of, up-to-date kind of vaccine efforts? That remains to be seen. But I do think that there could be an annual booster that might be COVID flu, just like we do see with the flu. But we're hopeful, and of course it depends on the variants that pop up, and if they have any resistance to natural immunity and vaccine-induced immunity, if they have mutations that make them more deadly, more transmissible, those kinds of things. And those are some of the things that we just don't know. But we are hopeful that this Omicron wave, as rough as it was, really did kind of get us to a threshold where between the vaccination efforts and the infection efforts, we're in a much better place to ride out these future waves.
Well, I see no more questions coming in. So we appreciate your time today, and we look forward to seeing you next week.
Yeah, and I think, Jen, we wanted to mention we'll be doing this next week and the following week. So, and we were looking at possibly, if things continue to go as we're hopeful, and it looks like it will, that possibly the March 28th, which would be that last Monday in March, would be our last one of doing these briefs. And we'll still have the Road to Wellness website where we post things. We'll still have the question and answers that can come in that way as well. And certainly if something were to change, we have that avenue to start up press briefings again if we need to. And that includes COVID or other things non-COVID. So thank you all very much. Jen, thank you so much.
Thank you. Have a great Monday.